Hello and welcome to this edition of City Hall Insider. I'm Jim Marshall of the New Bedford Cable Network, and our repeat guest coming back again, Damon Chaplin, the Director of Public Health for the City of New Bedford, who has just been busy, to say the least is not the right word. You've been doing yeoman work, and it's appreciated, but the last 18 months have just been crazy for you.
Yeah.
Thanks for coming in. Thanks for taking the time. Like I said, I know your schedule is booked solid right now, so I appreciate it.
Anytime.
So it's midsummer right now as we sit here and talk, and you've come in here on a regular basis and updated folks. Where are we right now as far as the pandemic?
We're at an interesting space. We're at a space where we're not quite where we'd like to be with vaccination rates, and we're starting to see an uptick in positive cases. But we're also at a space to see what level of breakthrough that we're going to be seeing within the community. So it's an interesting space to be at right now. We're starting to see some clusters develop within the city, but the real change between this time last year is that we're looking at different numbers. We understand that we have a certain level of breakthrough. I think in New Bedford right now we're at roughly about 11%. We're seeing as a breakthrough rate.
And for folks, what does breakthrough mean?
That means those folks that have been vaccinated that are reinfected with the virus.
Okay.
And so we expect to see a certain percentage of the population to be reinfected with the virus, around 10%. And we're seeing that. But the key is not so much that you're being reinfected, but it's how severe. Does the reinfection result in hospitalization, ICU, and ventilators, and then obviously death? And so that's what we're really looking at.
It does seem to be different, because I know you were on last summer. You've been on many times before that, but just from last summer, it does seem to be a bit different. If you could say it even seems a little more positive right now than it was 12 months ago.
Yeah, I think because we have room to grow with vaccinations, that's a positive way to look at it as well. The rest of the state is opened, which we weren't last year. And so it really is about getting as many people vaccinated as possible, providing as much cover for the community as possible. So we have a lot of work still to do. We are at about 41% fully vaccinated, about 48% for those folks that have received the first dose. And so we're well below the state average, and we're probably one of the lowest of the communities that are within the Vaccine Equity Initiative. So we still have work to do, but I do want to thank those folks that have stepped up and gotten vaccinated thus far. So 41% of the population has done their job.
And the city has done a good job, from where I sit, making the vaccines available. I mean, a year ago we were talking about we can't wait for the vaccines to get here, and now there's ample opportunities, locations, times to get the vaccine.
Yeah, we're at a space now where anyone that wants a vaccine can get a vaccine. We are instituting the block by block program, working with CIC Health and Blue Cross Blue Shield and the state. That program has been relatively successful. Over the last 2 weeks or so, we've done over 460 vaccines within certain communities. And so we're doing everything in our power to make sure that we communicate where those clinics are going to be, and we make those vaccines available to as many people as possible, particularly those in vulnerable communities.
I was looking at the show we did last year. I think it was in July we did it, but and you were talking a lot about, at that time, testing, where you can get testing, why it's important if you feel you've been exposed or what have you. Is there still, I don't want to say an emphasis on testing because I know it's on the vaccines, but is it still important to have those testing locations available too?
Oh yeah, the testing is still an important tool. We still have testing at Station 11. Our testing that was at the Wells Tooth has moved to the New Bedford Airport. And so testing is still an important tool, as well as the vaccines. And our job in the health department is to provide residents with as much information as possible that they need to make an informed decision for themselves and their families. The test is another tool that allows individuals to isolate and quarantine. It also allows our contact tracers to be involved and to give information and direction to residents that have tested positive as well. So the testing is an important tool. I don't think the testing will go away. It may shift from a public or community level testing to more isolated testings at either pharmacies or healthcare providers over a period of time. But it is still a very significant and important tool.
We were talking off air, but the Delta variant is the one people are talking about right now. And I asked you, and maybe it doesn't sound like an intelligent question, but I mean, is it in New Bedford? And you said yes. Yeah,
we've as of July 27th, we've had 41 lab tests sequenced, which means that they break them down to see what type of virus it is. And of those 41 lab sequences, 35 were Delta variants.
And you were explaining, folks, I mean, not to get too scientific, but obviously the Delta variant is COVID, but just for a broad definition, what is the Delta variant?
It's a mutation of the original virus.
And that's natural to happen with a virus.
It does happen, which is why we typically have a new vaccine every year for the flu. So the virus tends to mutate over a period of time. This is not anything different or new. It's just that sometimes when it mutates, it becomes more severe. And this particular mutation or variant, we're seeing it to be able to be transmitted more than in the previous one.
But the one thing, though, that you've said and that I read about is if you have the vaccine, it is effective against the variant. Maybe not getting it per se, but the severity of the illness that you would get is lessened by having the vaccine.
Absolutely, and it reduces the severity of the symptoms and outcomes from the virus. And so we're still looking to see the number of folks that are being reinfected that have been vaccinated. But then we're looking further to see of those folks that have been reinfected, how severe is it? And so our numbers at St. Luke's, our ICU numbers and our ventilator numbers are still pretty low, even though we're seeing an uptick in positive cases. So it seems like the vaccine is working and doing this job.
Well, you said a moment ago, just numbers-wise, which is interesting, you said, you expect about 10% to be reinfected.
Mm-hmm.
And when you looked at the numbers for the vaccines, the Moderna and the Pfizer were 90%. I know Johnson & Johnson was a little less than that.
Mm-hmm.
So there was never a guarantee that you wouldn't get it.
Correct.
Even if you had the vaccine. But I think I saw a study, but I don't know where, but it's like all three of them were like 100% effective against severe illness.
Correct. And that's key. It's effective against preventing premature death.
And from your standpoint, where you sit, that's really the biggest number.
And that's the number we watch. We can't help you if we can't save you. So
right.
We got to save you from dying first, and then we can do other things for you. But if we can't keep you from dying, there's nothing much we can do.
You've been tackling the vaccines for a long time. We've had conversations off camera trying to do PSAs and the like. How has that been going? Because as you said at the time, and you've actually been more aggressive talking about that, it has to come from neighborhoods, smaller communities. How has that been going right now?
Yeah, with the block by block, it's an ultra local process.
Yep.
And so it's basically we're doing a ton of marketing prior to. There's a truck that drives around that advertises the event. We pick a static location in an area of need, and we set up a clinic there, and then we disperse canvassers within that area, that half a mile radius of that area, and directs them back to that static location. And then on top of that, the other piece it basically takes all the things that we've been doing and puts it together in one neighborhood. So then it also allows us to do the home visits as well. If we come across someone who wants a vaccine, one of the canvassers comes across a person that wants a vaccine, but they're not able to get to the static location, we can disperse a clinician to that location to give them this vaccine on the spot.
When we were at the kickoff event, the videographer who covered it, Gus, was saying to me that somebody just kind of strolled up didn't even know the event was taking place, and they were just like, oh, I guess I'll get it. And they got the shot right there.
Yeah.
Is that sort of the impact you're trying to get?
Yes, we want to be like Velcro. When we want to be in the spaces where it's hard, you have to walk around us. And so that's the idea, is to be in areas where people typically congregate and they feel safe in their particular neighborhoods. And then we just go out and we try to encourage them to get the vaccine. Those canvassers, they do a phenomenal job of providing education around the vaccine, and then directing them to where they can get the vaccine. They take information. If today's not the best day for you, we take your information and we follow up. So we are being ultra aggressive and ultra local about our intentions about getting people vaccinated.
You are somebody who has a very good demeanor with folks, and when you talk to people who haven't got the vaccine, do you find that I don't want to say they listen to, but they're hearing what you're saying?
I do, and I've always said this. I think most of the people in New Bedford, they have responsible reluctance. They ask really good, informed questions. Most of the people that I have engaged with have been people that's on the fence. And I haven't engaged with a ton of the absolute no's, but I've engaged with a lot of people who are on the fence and who are asking questions and looking for answers and really trying to get an understanding of the best route for them and their families. And so I think the world of the New Bedford community. I think the world of the neighborhoods. I think the world of the people. I think they're smart. I think they're energetic. I think they ask the right questions, and we're hoping that with all the effort we're putting forward, they make the right decision.
I was going to ask, do you think it's, at this point in time with the hesitancy, is it the message or the messenger that's, I don't want to say the issue right now?
I think in the beginning it was the messenger in the beginning.
Because you've talked about that in the past. I remember you saying, they don't want to hear from me.
Right.
And you said to me, they don't want to hear from you.
Yep.
They want to hear from people they know about.
Correct. I think in the beginning it was the messenger getting the information from a trusted source, whether it be a healthcare provider or friend, family member, relative. But I think now it's about the message. And that help us save lives. And so it's really about making sure people understand that we're still here. The vaccines, we've still got work to do. This thing is not over yet. We're encouraging those folks who've gotten their first vaccine to make sure that they get their second vaccine. And so we don't want to have people who are under-vaccinated. And that's the other issue that we have to really focus on, and making sure you got your first vaccine, but let's make sure you go back and finish up and get that second one.
Do you share the assessment at the national level when they say it's a pandemic right now, the unvaccinated?
Because
I've seen that a lot.
Not sure if I agree with that.
Okay.
I'm not sure. Like I said, I think we still have a lot of work to do as a public health body. And we are paying for past sins, right? We're paying for things that were done in the healthcare and medical community years and years and years
50
ago.
50 years ago, 60 years ago, yeah.
We're paying for past sins right now. And so the bill is due. And so we still have a lot of work to do.
The one thing that I get curious about is vaccines have been around for a long time, measles, polio, all these things, and there didn't seem to be the hesitancy then. But for this particular one, and obviously I wasn't around. I remember you and I talked about it. We got chicken pox, we got measles shots and stuff before school. But now it does seem to have the hesitancies for this particular one, which I find that interesting, because people didn't seem to question those, but now they do.
And I think it's the way that, unfortunately, I think it's the way it's timing. It's who was delivering the message and how the message was delivered early on and how it was being developed and the level of communication that was being shared with the community. I think all that matters.
Yeah.
I think the process directly affects the product. The way that the process of developing this vaccine and communicating with the public, it mattered. And that's why I say it's responsible reluctance, because they are responding to the way this was done.
I know one of the folks that I saw over the weekend was saying that one thing that would help is if it wasn't emergency use and if it was just approved. That might be, and I don't technically know what that, I know what that means, but I don't know how that happens. Mm-hmm. That they think it would be better, and people who haven't received it said if they approved it and they said it's good, instead of I guess the emergency use is a sticking point for people.
It may be. There'd be a couple of different things that would need to happen, but the FDA approval will allow governments, municipalities, businesses to make a more proactive role in all of this. And at the same time, I think it does have this seal of approval from the FDA. It matters to some folks.
Yeah.
And it's a process. It's a process. Developing a vaccine, getting approval, it's a process, and that process is part of what gives people comfort in taking the next step. And so if you disrupt that process, which we just talked about, then people have reluctance.
We're coming up, I mean, we're not there yet because we're midsummer, but I mean, September, returning to school, right around the corner. I know there's questions right now, and I know the governor is not looking at mask mandates at the moment, but I know people were hoping to go back to work in September, and if you had a crystal ball, what would you say September looks like, or the fall looks like? Is it even more of a return to normalcy? Kids will be back at school, workplaces will be open, because a lot of places still aren't back to work yet.
No, I think we will continue as we are. I think there may be some other things put in place. We haven't done anything here at the city other than we've discussed providing recommendations to our community partners, those being businesses, school districts, housing authorities, all the ones that we've partnered with before. I think the initial thing will be a recommendation based on what the CDC has come out with. And then we have to take a close look at our numbers, the key indicators that we talked about, ICU, emergency room visits, ventilators, and then obviously the number of deaths that we're seeing. And so if we see those things start to creep up and increase, we have to pay attention, and we may need to take a more active role in protecting the public. But right now it's surveillance. It's surveillance, and it's education and information to folks. And so
I know there's still a lot of questions, where you sit. Do you feel though that from where you sit, you have a better, I don't want to say grasp is the right word, but you have a better, at least, understanding of the issues, because you've had to deal with them now for over a year, 18 months or so?
The issues related to the vaccine?
Well, the vaccine, just kind of in general, how you're looking at the pandemic, how the city's handling it, the responses and what have you. I just get the feeling that it seems like there doesn't seem to be the panic right now that there was a year ago. And it seems people are, like you said, thinking, they're asking intelligent questions. People have a better grasp, I guess, of what we're dealing with.
Mm-hmm. There is still an urgency. Mm-hmm. There's less of an emergency, but there's still an urgency. Mm-hmm. Again, our vaccination rates are relatively low, and that's the cover. That is the cover that's going to help us move forward. We do know a lot more about the process of getting the vaccine into the community. We're learning through all of our trial and error how best to communicate. We're identifying gaps in our communication processes, and we're trying to fill them as soon as possible. So yes, we are learning more. I do know a lot more about the community and their relationship to this particular vaccine. We know a ton more about how to engage with certain communities. And so this has been a learning process for all of us. We've learned a ton on how to engage with partners. And so, we do know a lot more about, we have things in place that we didn't have before, Jim. Mm-hmm. So we have a recovery center that's available to us that we didn't have when this thing first started. So we had to put systems in place when it first started, and that was part of the anxiety, that we didn't have these particular systems up. Now we have these communication systems up. We have, recovery centers that are available to us. We have a system for coordinating with our homeless. So we have different systems in place that we didn't have before.
I think that's the word that I couldn't think of, anxiety. I think it seems to me, just perception-wise, the anxiety level in general is lower than it was a year ago.
Yeah, because we have those systems in place, and we did not have those systems in place prior to, and so that was an important piece. We've been meeting pretty regularly now for over 18 months.
Oh, you read every week? You have your meetings.
That's right. So that's established. We have an established communication. We have more partners available to us, and we have a vaccine that we hope that's going to be working, that will continue to work. And so,
you and I have talked prior to the pandemic. You have, I don't want to say you had a wish list, but you had so many things that you were looking at health-wise for the community in New Bedford, which have, I don't want to say it's been sidetracked because the issues don't change.
Mm-hmm.
From your standpoint, those things that you were looking at, can you still do those right now?
Well, we can, but not at the same level. So we are definitely looking at opioids. It's still an issue in New Bedford.
Highest death rate ever last year.
Yeah, we're still looking at opioids. We're still looking at youth violence, gun violence. We're still looking at mental health. We're still looking at housing and homelessness. Yeah, there's a litany of things that I would like to be able to put my full attention on.
And we were talking about you had a game plan, because we were talking here about you wanted to do shows and PSAs and getting stuff out.
Yeah.
And it just it was an aggressive and ambitious plan that you had, and it just obviously on March 15th it just got totally changed. But those issues are still there.
Yeah, they're there and they're proliferating, and we just have to add more capacity to the health department. I don't know any other way to say it. We need more capacity at the health department. We need to increase the number of staff that we have and the type of staff that we have. And so we're getting some of that through some of the grants that are coming from the federal government and some of the grants that are coming from the state, but we need non-competitive funding. We need more non-competitive funding from city council, from the city, from the state, local health department. We need more capacity, more support.
You were talking too, like hunger is an issue that you that you had, and at one point you were talking even about Wi-Fi access.
Yeah.
For kids and for families.
Yeah.
And you don't think of those as health issues, but
they're related, particularly if you are in a system where your school system is 100% remote. Not saying that we were 100% remote, but a number of our kids were working from home, and if they don't have access to Wi-Fi, they can't get their school lesson. They can't participate the way that they normally would. So yeah, it becomes an issue. There's a litany of things that happen as a result of COVID that are interrelated to all the other things that we've been working on. But those hierarchy things, access to housing still is relevant now. Our homeless population, access to clinical services for our mental health patients, access to services for our substance abuse. All those things are still very relevant, and we have to figure out a way to kind of cover all of them. Have
you been able to at least, again, I know you had plans in place, but have you at least been able to push them ahead, even at a small level? Not as much as you wanted, but even at a small scale? Yeah, so what we did is we, through contract, we've contracted with Partners in Health and their accompaniment unit, and they've come on and they have been an incredible partner. I cannot express, they came in at the right time, just around the first of the year, and the biggest asset that they were ready and willing to help wherever we needed them. And so they've been with us since about March or April, and they've been, the support that they've given us is just incredible. So we would not have been able to accomplish many of the things
that we have been able to do without them. And so they'll be with us until, I think until next year, just after next year. But that's been incredible.
Because these issues aren't just New Bedford exclusive. I mean, you've talked about it's New Bedford, but it's the surrounding towns too. Everybody's dealing with the same things. There's no borders on just one.
Yeah, which is why we talk about public health districts. We talk about communities working together, better together. The greater New Bedford area, those areas of Acushnet and Fairhaven, Freetown, Dartmouth, all those communities working together. We work better together because the virus doesn't know any boundaries. And so if we can provide a level of support for those communities that will help protect all the residents in all of those areas, why not? And so the state has issued a grant, a public health excellence grant that we've applied for, and hopefully we'll get, that will help to lay the groundwork for how we work together going forward.
Got about a minute here left, and I just want to, so, I mean, as we sit here and we'll leave, you sound optimistic, or you sound like there's hope, there's a way out.
There is.
For the whole thing.
This is our time. This is our time as a community to come together, to work together, to show the rest of the state how New Bedford works together. We have engagement with our community-based organizations and our partners, our hospitals, our healthcare systems. This is our time to show the rest of the state how we work together. And I think we're going to do a great job. We have done a great job, and we'll continue to do that. This is our time to shine. And so we have our work cut out in front of us. And so now it's time for us to put the metal to the pedal.
For folks who have questions, and I know you get questions all the time, there's plenty of resources. How can folks get the information that change on a daily basis, but the information's out there?
The best source is the city's website. Go to the health department's website, and there'll be links there to both our numbers, our daily numbers. There'll be links also to the telephone number for our vaccine line. And then you can also get information, links to the state's website as well.
It's good seeing you. I know you're busy. Thanks for coming in. Appreciate it.
Thanks, Jim.
That's going to do it for this edition of City Hall Insider. I'm Jim Marshall of the New Bedford Cable Network, and we'll talk to you again soon.